Hey students, let's talk about now the lymphatic system and the immune systems. So the lymphatic system and the immune system, they are completely different systems, but they overlap with each other and they use each other's different structure to work. Okay? So by lymphatic system, we are referring to an extensive network of vessels that penetrate nearly every tissue, as well as different numbers of organs that provide support along the way. So lymphatic vessels are very similar to the other vessels we are more familiar with, such as the arteries and the veins, right? And the lymphatic organs are a number of different organs that are scattered throughout the body. They have a similar function. They either are filtering or helping us with the immune response and storage of lymphocytes. This is a picture of the lymphatic system. You guys can see all in the green is the lymphatic system. You guys can see all the vessels, and also we can see here little clusters of little dots. Those are lymphatic nodes, and they are scattered in different places around the body. Some of them we can see them, like the ones in our necks, like the ones in our axillary area, or the ones in their inguinal area, as well as the one that you guys see here in the cervical area. There's some other ones that are more deeper, like the ones in the thoracic area or in the mesenteric area, and we're going to talk about them more in detail. So the lymphatic tissue is named after the lymphocytes because they are found in large numbers in that area. So what are lymphocytes? We have talked about them before. They are white cells, right? They're also macrophages, and it's also rich in reticular connective tissue. The reticular connective tissue is basically the framework for a lot of the structures, like the spleen, like the malt organs, or the tonsils, okay, which are malt organs as well. Okay, so the lymphatic system versus the cardiovascular system, they're very similar, but there are significant structural difference and also functions. Okay, so we're gonna see the next slide, and we're gonna talk more into detail. So on your right side, you guys will see that we have the lymphatic system. Okay, so in the left side, you guys see that we have the cardiovascular system. By cardiovascular system, we mean mainly arteries and veins. So, of course, in the cardiovascular system, it contains plasma fluid, but also contains blood. And the lymphatic system only contains lymph. Okay? Either in the cardiovascular system, things are going away or towards the heart, and we can think about this like as arterial circulation and venous circulation. And then with the lymphatic system, the fluid only flows towards the heart, but it's not going to drain in the heart. It's going to drain in the subclavian vein junctions, either on the left side or the right side. Of course, blood is mainly carried in the arteries or vein, and of course, one of the protections that we have when we cut is that we clot. Lymph, and speaking specifically of the fluid, cannot clot. It doesn't have that function. Okay? Capillaries attached to arteries and vein. We have the circuit of arteries, arterioles, capillaries, venules, veins, heart, so on. Circle of life, right? And with capillaries, they're blind tubes, meaning that they only start in the interstitium and then they go bigger and bigger to drain later in a vein, all right? In the cardiovascular system, only veins contain valves. In the lymphatic system, all vessels contain valves. And there is a similarity between those two because the vessels in the lymphatic system, they lack of smooth muscle, similar to the very little smooth muscle that veins have, right? Then, sorry about that. The cardiovascular system is a closed two-way system in its systemic or pulmonary circulation, and in the lymphatic system, there's a one-way system. We pick up fluid in the interstitium and then we drain close to the heart. Okay, so in the arteries, heart contractions causes circulation in the arteries, and in the case of the veins, either skeletal muscle, one-way valves, thoracic pressure changes the circulation in veins, something that is very similar to the lymphatic vessels. With the fluid is aid by valves and skeletal muscle contraction. All right, and then we have fluid in the cardiovascular system that contains the form elements of blood, either red blood cells, white cells, thrombocytes, and other proteins. In the lymph, it contains B and T lymphocytes, meaning white cells, macrophages, other white cells, and other proteins that are important to either immune response or proteins that are found in the interstitium. Okay, so here we can see a little diagram of all the three important vessels together. If you guys can see on the right side, we see red arteries, blue veins in the left, and then in the middle we see this green friend. This is the lymphatic system. Okay, so if we zoom out right here, we see arterioles that are going to become capillaries, and at some point they're going to turn into venules and then veins, right? So this is when the lymphatic capillaries come into place. All the space that is here in beige is tissue. Fluid that is in the tissue is known as interstitial fluid. All right. Once interstitial fluid is picked up by these capillaries, is going to be known as lymph. Why these capillaries are here, and specifically speaking of the green ones, is because they pick up the excess of fluid that is filtrated and excreted by our other capillaries, because they carry nutrients, they carry gases, but also they cannot linger there forever, so they need to be picked up. Okay, starting from there, that fluid is going to go and flow and be filtrated by these friends. The lymphatic vessels going to be filtrated by lymphatic nodes, just to pick up any foes, meaning pathogens, and at some point it's gonna be draining in the venous system and then to the heart. Okay, it's a one-way system, as you guys can see. It's not connected to anything else. It's not a closed circuit. It's a beginning and end. Think about it like a shortcut. Okay, so components of the lymphatic system. The lymph is the fluid. What's the difference between lymph and interstitial fluid? Location. So if it's in the lymphatic vessels, it's lymph. If it's in the interstitium, it's interstitial fluid. Okay? So lymphatic vessels are an elaborate network of drainage vessels. This is pretty important. Drainage vessels connect the excess of fluid and return it to the bloodstream. Okay? So starting from the smallest to the largest, we have capillaries, we got lymphatic vessels, we have lymphatic trunks, and then we end up with lymphatic ducts, okay? Also, this is the network of vessels. Now we need to talk about the lymphatic organs. We have lymph nodes that are like those like bean-shaped organs. We got tonsils, and we have talked about them. Those are the ones that are located around our pharynx, palatine, adenoid, and sublingual or lingual. Then we have the Peyer's patches in our intestinal lining, like the ileum, spleen, thymus gland, and the bone marrow. All right, so what are the functions of the lymphatic system? So the lymphatic system does the following. It does fluid recovery. So the excess of fluid that is and molecules that is in our tissue or interstitium cannot be lingered there forever. So we need to recover that extra fluid. And that fluid is rich in protein, so it recovers it via the lymphatic capillaries. It also carries immune cells, such as white cells, such as lymphocytes. So it protects our bodies from pathogens and microbes, such as viruses, fungi, or bacteria, right? And they carry the immune cells. So here we have also lacteals. Lacteals are modified lymphatic vessels that absorb dietary lipids. Lipids sometimes are too big for the capillaries to absorb the other nutrients. So the lacteals are big enough that they can absorb the lipids from the lumen of intestines, get transformed and get into the lymphatic system, and then those guys in the form of chylomicrons are going to be transferred to the lymphatic system. Okay, and at some point they're going to go to different tissues and then metabolize. Also the liver plays an important part in it. Okay, also has a function of filtering. As we were talking, the lymph nodes are there, and they're going to act as a filtration area. It's like a toll booth where things can get caught, filtrated, and go to their path. So if we think about, we have different lymphatic nodules along the way. They're going to filtrate, and if they cut something, they get inflamed and create a response. Okay, so lymph versus interstitial fluid. So location, 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 location. When interstitial fluid goes into the into the lymphatic vessels, it's called lymph. Okay, lymph contains water, protein, and ions. Way different than blood. Okay, again, lymph contains water, proteins, and ions. Lymphatic vessels. Now we need to talk about again their extensive network of drainage vessels that collect the excess fluid and returns it to the bloodstream. Again, this is a one-way system, and we're going to talk from smaller to larger. So we start with capillaries, then vessels, then trunks, and then ducts. So lymphatic capillaries, lymphatic vessels, lymphatic trunks, and lymphatic ducts. Okay? So the interstitial fluid enters the lymphatic system through the lymphatic capillaries. Okay, this is the smallest version of the lymph vessels. Okay, lymphatic capillaries are way larger and more permeable than the blood capillaries. We have talked about the capillaries in our blood vessels chapter. We have fenestrated, we have continuous, and we have sinusoid. These guys are way larger than those and allows a lot of stuff to go in. That's why we see white cells in there. So the lymphatic capillaries allow only interstitial fluid in, so it's only one way. Once you're in, you cannot go out. You have to complete the whole route, okay? Now we see a little representation here. Veins are the blue, arteries are the red. In this case, it will be arterial and venous, of course. And then, of course, in between these guys, we'll see what they are, capillaries. The green ones are lymphatic capillaries. If we zoom out closer, this is the interstitial space, and what's going in is interstitial fluid going into the lymphatic capillary. Okay, so specialized lymphatic capillaries, we talked about the lacteals. They are located in the small intestine, and they absorb dietary lipids and lipid-soluble vitamins. They're too big to be in the regular capillaries. This lymph is milky in color due to the fat content, and this fluid is going to be called chylus. Okay, then the chylus is going to enter the lymphatic capillaries, and it travels through the lymphatic system like the other lymph fluid does. Okay, we see them here. As you guys can see, we see the villi of the intestines. Each vilus has, of course, the red of capillaries, but also has the lacteals, okay? This is where absorption happens, okay? Through the enterocytes. The lymphatic collecting vessels, and this is now the bigger structure, so we're coming from capillaries to lymphatic collection vessels, okay? So they're, of course, formed by the convergence of lymphatic capillaries. They are similar to veins in the sense that they have 3 tunic layers, but also they have valves, okay? And they are connected to lymphatic nodes, okay? Those are gonna enter the lymphatic nodes as lymphatic afferent vessels or afferent lymphatic vessels into the nodes, and then they will go out as efferent lymphatic vessels, going in, going out. Of who? The lymph nodes, okay? Here we see a lymphatic vessel. As you guys can see, it's only one way, and to prevent backflow, we have valves, similar to veins. This is an histologic sample, and you guys can see the valves here, okay? Here you guys can see it more in detail. This is clearly a valve, okay? Okay, so the lymphatic trunks. So now they are the creation of the convergence of collecting vessels. So we're going bigger, right? So there are several lymph trunks found in the human body. We have the lumbar trunks, and of course they drain what? Their lower limbs and the pelvis. We have the intestinal trunk that drains the abdomen, bronchomediastinal trunk drains the thorax and the chest. Then we have the subclavian trunk, drains the upper limbs, jugular trunk drains the head and the neck, and intercostal trunk drains the intercostal spaces. Okay? Now we have the collecting ducts. So these are the biggest and the largest expression of the lymphatic system. So they, as I said, they're the largest of the lymphatic vessels. Okay? They're formed by the convergence of collecting vessels and the collecting trunks, right? So there are two main collecting ducts. They are the right lymphatic duct, and this is pretty important. Keep this one in your mind. Right lymphatic duct, and then thoracic duct. The thoracic duct is a primary lymph duct in the human body. Okay? Why? We're talking about this guy. It's the primary because this guy basically drains the left side of the face, left side of the neck, and the rest of our body, with the exception of the right side of the neck, right side of the head, and the right upper extremity, and the right portion of the thorax. Okay? After entering the lymph duct, the lymph fluid is then returned to the venous flow. Okay? Doesn't go straight to the heart. It drains to the venous flow. And we see it here. So these are the lymphatic duct. We have the right lymphatic duct, and this one empties at the junction of the right jugular and the right subclavian veins. The thoracic duct, and we're talking the one that it's on the left side, is gonna drain at the junction of the internal jugular and the subclavian veins. Okay? And then, as we see here, the sternocali is the most inferior part of the thoracic duct. All right? This will make a little bit more sense in the next slide. So here are we seeing the thoracic duct. This one drains, pretty important guys, the left side of the body. Okay? The left side of the body, as well as the right side of the body inferior to the diaphragm. So we are basically draining all this, okay? All this, okay? The portion that is on the reddish or pinkish here is drained by the right lymphatic duct. This is pretty important. It drains the right side of the the right side of the body superior to the ribs, head, chest, and right upper extremity. And you guys can see it here in the pink. Okay? Take your time to read this because this is pretty important and it's significant. See the names? Thoracic duct. It doesn't say anything like left. It says only thoracic duct. Okay? So the right lymphatic duct drains right side of the face, right side of the neck, upper right extremity, and right side of the thorax. The rest basically is drained by the thoracic duct. Okay? Now let's recap the flow. So we have the interstitial fluid is going to go to the lymphatic capillaries, and at this point the fluid is going to be called lymph. Then we're going to go to the collecting vessels that is going to be with several filtration little spots known as lymphatic nodes. Then it's going to go to the lymphatic trunks, then to the collecting ducts, then to the right of subclavian veins, and then to the superior vena cava. Now we're draining to venous flow, and at the end we're going to go back to the right atrium of the heart. As you guys see here, there's no connection. It's a one-way system. Okay? So now, how are we aiding for the lymph to be transported? So the lymphatic flow is assisted by the contraction of skeletal muscles, also the actions of walking, exercise, and movement. Okay? There are pressure changes in the thorax, the presence of valves, pulsation of nearby arteries, and the smooth muscle contraction of the walls of some lymphatic vessels. Okay, so as you guys can see, it resembles more to the veins. Okay, approximately 3 liters of lymph is filtered through our lymphatic system. That is a lot. All All right, so now the lymphatic organs. So they are organs that are specific to the lymphatic system. There are primary and secondary lymphoid organs, okay? A lot of these organs contain large amounts of lymphocytes as well as macrophages in their main structure known as reticular connective tissue, okay? So we got primary lymphoid organs where the B and T lymphocytes mature or become immunocompetent. We're talking specifically about the red bone marrow and the thymus, okay? The secondary lymphoids is where some mature lymphocytes encounter antigens and they are activated, so they are ready for war, such as lymph nodes, spleen, malt, containing structures such as tonsils, pear patches, and the lining of the appendix. Okay? So what are the lymph nodes? Think about like little spots that filter, little toll booths. There are approximately 600 of these oval-shaped organs scattered throughout our body, okay? They are the size of 1 to 20 millimeters. That's itty bitty. They can be basically like as big as maybe quarter of an inch, probably, or itty bitty of a filament of our hair, okay? So since they're so small, they're not visible, but some of them are closer to the surface, like the inguinal ones, the axillary, and the ones located on the neck, okay? These are the most abundant and numerous of the lymphatic organs. Okay, so as we have talked about other organs, they kind of follow like a same pattern, or we have like classified them in that pattern. They all have a capsule, right? That's a fibrous connective tissue that protects them. And then there are two other regions. We have a cortex and we have a medulla. Okay, think about the orange. So the cortex is the outer region that contains the lymphatic nodules, also known as follicles, all right? And they contain the B and the T lymphocytes. And the medulla is the inner region that contains macrophages. So think about like layers of protection. If something goes here, they're going to be detected by the B and T lymphocytes or getting eaten by the macrophages. Okay? So the lymph nodes also filter. They filter foreign substances from the lymph and act as a site for lymphocyte activation. So if something gets presented here, such as bacteria, they can get destroyed, and also some fragments of that bacteria can be presented so that immune system can react to it if we see it in the future. Okay, each lymph node has an afferent and an efferent lymphatic vessels attached to it, meaning that something is going to go in or is going to go out. All right, and of course each lymph node has vessels to supply to the tissue because they're alive. Those blood vessels enter and exit to an area called what? Hilum. Okay. All right, and here we see a little representation of the lymphatic node. So as you guys can see, this is the capsule. Then we have the cortex, and then we have the medulla here. All right, so all those purplish areas, the ones that look like little grapes here, the lymphatic follicles, they contain B and T cells. And here in the medullary cords, there are more lymphatic or immune cells, I should say, like macrophages. Okay, they all have a follicle and then they have a germinal center. Okay, take your time to read this. It's in your presentation because it has a lot of important stuff. Okay, and as you guys can see, something is coming in through the afferent vessels and something is coming out through the efferent vessel. Okay, so lymph nodes are scattered through our body, but they're concentrated in specific areas as well. Okay, so there are axillary lymph nodes, there are pelvic lymph nodes, inguinal lymph nodes, cervical lymph nodes, thoracic lymph nodes, and abdominal lymph nodes. On those, you can feel the axillary, the cervical ones, and the inguinal lymph nodes. Okay, they are palpable when they are enlarged. The ones in the thorax, the abdomen area, and the pelvic area, they're not palpable because they're deeper. Okay. So as I said, the lymph nodes during times of illness or infection, because they caught something, they might become enlarged, and this is known as lymphadenitis. Okay. Increased size of the lymph nodes may also be an indication of cancer, and this is an important piece. Sometimes when there is an infectious process, you can feel those lumps and they're also going to be painful. During a cancerous process, that usually is not the case. Now, this is a histological sample of a lymph node. As you guys can see here, you see all these lymphatic nodules or follicles. They are in the cortex. We have the outer layer known as the capsule and then the medulla, right? Okay, now let's leave the nodes and let's talk about the spleen. So the spleen is kind of like regular shape. It's found on the left lateral side of our bodies, more like laterally to the stomach. And it touches the stomach, the left kidney, and the pancreas, and the large intestine, okay? That's why when we're talking about the flexions of the large intestine, there's a splenic flexion. You guys remember that? If not, go back to your presentation about GI. Okay, so now we're just gonna talk about their size. Is usually the size of a fist, okay? It just varies by person. Of course, it's gonna be smaller in a kid. All right, so here's the spleen. As you guys can see, is laterally of the stomach, okay? So it provides a site for lymphocyte proliferation, immune surveillance, and response. Mature lymphocytes are gonna be here, okay? It also works as a blood cleanser, recycles breakdown of products from the red cells because this one is the cemetery of our body for red cells, okay? It also releases those products so it can be stored in the liver and also other salvaging of materials such as hemoglobin. Also, it stores platelets and monocytes, okay? The spleen has two types of tissue mainly. So we have the white pulp. This is where the immune function is going to take place, okay? So we have lymphocytes and macrophages. And then red pulp, which contains RBCs or red blood cells, and any blood-borne pathogens that are here are destroyed, okay? By who? Well, white cells. And also contains many erythrocytes. Why? Because this is where a lot of these red cells come to die. Here we see a little diagram. So red pulp, of course, you can see is this pinkish area. White pulp is this area around here. Here's a histological sample. You guys can see all these follicle centers, and as you guys can see, and I told you guys in the class, there's a follicle and there's a germinal center where those cells are going to be. The red pulp is where a lot of those red cells are going to be. Now we're going to talk about the thymus. This is a biloved primary lymphoid organ located superiorly to the heart, okay? And it's between the sternum and the aorta, okay? This one is kind of like lymphocyte T college, where they program and mature and they become immunocompetent. The thymus produces thymosin. It's a hormone that makes lymphocytes T immunocompetent, okay? That way they can clearly respond to an infection, okay? It's most active during childhood because we are growing and we are just keeping up with the size and our needs, okay? Once we stop growing, we don't need that, okay? And it starts to decrease and atrophy. Here it is. You guys see the thymus, then it's a little sample of the thymus, and then you see the hazel corpuscle, also known as the lymphatic corpuscle. This is where the cells are gonna become immunocompetent. All right. Then we have the rainbow marrow. This is where also a lot of the form elements or all the full form elements of the blood are gonna be present and produced, meaning red cells, white cells, and platelets. For matters of this presentation, we care about the lymphocytes B because this is where they're gonna become immunocompetent. And of course, a red bone marrow is located in the long bones, such as the epiphyses of your femurs. Now we have mucosa-associated lymphatic tissue. These are kinds of tissues that are strategically located in places that we are having constant entrance and encounters with foreign substances such as food or air, right? So the largest malt-containing structures, and this is important, malt-containing structures, okay? These are located in other organs that have a different function. Tonsils, they are located in our pharynx. mainly oropharynx and nasopharynx. Think about the palatine tonsils, lingual tonsils, and adenoid tonsils. We also have the pyre patches in the ileum, and then the appendix. There's no function known for the appendix, but they are located there also if they encounter any invader. Now, let's talk about the tonsils. They are large patches of lymphatic tissue in the back of the oral cavity and the pharynx, aka throat, right? Contains tonsillar crypts to help trap material such as bacteria and particulate matter so it can fight it and not allow it to go anywhere else. This is the first line of defense against inhaled and ingested pathogens. We have pharyngeal tonsils, we have palatine tonsils, we have lingual tonsils, and tubal tonsils. They surround the openings of the pharyngotympanic tubes, all right, in the pharynx. We're talking about this. We're talking about this area over here, okay? But here we can see the other ones that we care or talk about more often. So we have the palatine tonsils here, we have the lingual tonsils here, and then we have the pharyngeal tonsils here, okay? This is a view of how they look in real life. This one is a little bit inflamed, not as much, but as you guys can see, it's red. So when we get sick, you can see a lot of white spots in this. On the other side, this is a histological sample, and as you guys can see, and I told you guys in class, we see a lot of follicle or lymphoid follicles where there are a lot of white cells. And this is a tonsillar crypt where bacteria can be trapped. The trade-off or the downside is like when these guys are chronically infected, bacteria just likes to live here and proliferate, and then we get chronic strep infections. And when that happens, this guy is not doing us any favors. We need to take it out, okay? Here we see a side-by-side how normal tonsils look versus inflamed and sick tonsils. It can be a viral reason, can be a bacterial reason. You guys can see it. And of course the pus is detritus, which is just dead tissue. Now we have the pyre patches. Pyre patches are located specifically in the ileum, distal portion of the small intestine. They trap bacteria from incoming air or food and destroy them with macrophages, okay? You guys can see them here. They're all these guys located, and you guys can tell them apart because this is a telltale structure of the ileum. You guys can see them here as well. As you guys can see, they're not encapsulated. They are embedded in the structure that is located, in this case, the ileum. You guys see it here. Okay. Then the appendix, it contains mucus-associated lymphatic tissue. The appendix itself, we don't know what it does. We don't know what it is there for, okay? Because food is going to come this way. So it's, as so far as we know, it's not related to absorption of anything, but it's there. And sometimes it likes to get inflamed, and there's lymphatic tissue there. All right. So now let's move to the immune system. So the immune system is there to protect us from pathogens and invaders, right? Such as bacteria, viruses, fungi, and other invaded microbes, okay? That can cause damage to us, diseases, or illness, okay? So we don't want them here. We have one that is the first, second, and third line of defense. The first two are the non-specific immunity, the one that we are born with, okay? And then we have the specific immunity that we're going to develop either via infection or encounter or via vaccination. So when we talk about innate versus specific, let's talk first about innate. So it's not specific and we are born with it, okay? So this is immunity acquired by the body's structure and function, okay? It's non-specific because regardless of the pathogen, the structures protect the same way and treats everything identically, okay? The adaptive specific immunity is immunity that is adapted to defend against specific foreign invaders. Think about a lot of stuff that our bodies have developed its defense to it, such as antibodies. Now, side by side, so innate immunity is directed against any foreign invader, okay? And it's our anatomy and physiology who provides that defense. Let's talk about skin, mucous membranes, phagocytes, body secretions, fever, inflammation, and antimicrobial proteins. Okay? It does not keep track of past infections because it doesn't have that capacity. The skin doesn't have a capacity to do that, neither the mucous membranes, right? So now let's talk about the other function. It doesn't release antibodies because that's the function of another piece that we're going to talk later, okay? And it bounce responds very rapidly, such as the phagocytes, the proteins and the cells involved in the inflammation process, as well as other responses such as the body secretions, okay? So the adaptive immunity is directed against specific invaders, okay? It's developed to attack the specific, more sophisticated invaders, okay? Immune cells can recognize that invader and produce antibodies against it, okay? Includes the B and T antibodies, okay? Sorry, B and T lymphocytes. Let me repeat that. B and T lymphocytes, also known as the B and T cells, okay? And then macrophages, they are also white cells, okay? This one keeps track of past infection. That way it can mount a response if you see that invader again. It does release antibodies. And of course, since they are more specific, they are not in constant deployment, let's say that way, it takes a longer time to mount a response. Here a little bit more in detail. So we have the innate defense, meaning the first and the second lines of defense. And then we have the adaptive defenses, the third lines of defense, okay? So we have surface barriers such as skin and mucous membranes, and internal defenses such as phagocytes, natural killers, the inflammation, antimicrobial proteins, and fever. And then on the third line of defense, or also known as adaptive defenses, we have the B cells, part of the immunity, and cellular immunity with the T cells, okay? With the first line of defense, we have external barriers that are impenetrable to most pathogens that assault us each day. Think about all the things we're exposed every day, and thanks to this first line of defense, we don't get sick. That's why when someone gets burned, we are always concerned about dehydration and also infection, okay? So this is, of course, a non-specific line of defense, meaning it treats everything the same that it comes in contact with, okay? Other examples of the first line of defense, we talked already about the skin, but also we can think about the same way about mucous membranes, respiratory, genitourinary, and digestive tract. They are a layer, they are a defense, they're a wall, right? And then secretions, vaginal secretions. They're secretions produced by the flora of the vagina that creates a lower pH, and that way it doesn't let other pathogens grow. Urine, feces, vomit, saliva, tears, and skin oil. The point is not to allow anything in, and if not, it gets trapped and taken to another place where it's going to get destroyed. All right, so continuing with the first line of defense, there are a lot of chemicals that are part of the first line of defense, like the presence of acid that inhibits the bacterial growth. Think about the vagina, think about the stomach. There are enzymes also, for example, in the saliva or in other places that destroy bacteria and other microorganisms. Then we have the mucin, aka mucus, that's going to trap microorganisms. Then the fensins, there are proteins, there are broad spectrum antimicrobial molecules that help control the bacterial and fungal colonizations, and other chemicals that are present in our bodies. Now let's going to talk about the second line of defense. This is still innate, it's not specific, includes phagocytes, natural killers, inflammation, antimicrobial proteins, and fever, okay? So the phagocytic cells, basically they eat and engulf either infectious cells or materials. They're usually the macrophages and the neutrophils, okay? They're the biggest eaters, okay? The natural killers are other cells that we are born with it. They lyse, meaning destroy and kill cancer cells and virus-infected cells. They are not phagocytic. Basically, they target the protein, the cells, and then they basically give him like a clockwork bomb, so they died. Okay? So inflammation is the response to either injury, heat, irritation by chemicals, infection by a pathogen, and what basically it does, it prevents spreading of that damaging agent to nearby tissues. Disposes also debris and pathogens and sets the stage for repair and also alerts that something is going on in that piece or portion of our body. So many chemicals are involved in the inflammation process. We have the histamine, we are very familiar with it. Kinins basically recruit other proteins to an inflammation process. Prostaglandins, in complement, they either destroy those invaders or they produce the inflammation process and maybe pain. Inflammation of chemicals also dilate the local arterioles and make local capillaries leakier. So if these things are leakier, what's going to happen? Swellness, right? Because all the fluid that is in the capillaries is going to go to the tissues, okay? This also attracts white blood cells to the area and there's an immune response. So what are the classic signs of inflammation? We have redness, heat, pain, and swelling. Rubor, calor, dolor, tumor, all right? Then the other second line of defense is fever. Basically, we're cooking the invader, okay? So it's the normal elevation of the body temperature, and it can be caused by a number of things, okay? When macrophages and white cells are exposed to pathogens, they release chemicals known as pyrogens, okay? The pyrogens flow through the bloodstream to the hypothalamus, which controls our body temperature and causes this area to increase our core temperature, aka fever, okay? This is where Tylenol acts upon, so our temperature goes down. All right, so we also have antimicrobial proteins such as the interferon and the complement, okay? So what does the interferon do? So it's a protein secreted by dying cells telling them, hey, I'm sick, don't get close to me, I'm infected, and if you see any weird thing coming out of me, interfere with that replication, okay? The complement is a group of 20 proteins or more that when activated, they enhance the inflammatory response, but also call other cells to kill those pathogenic cells, okay? Now we're gonna talk about the third line of defense. This is something we're gonna adapt to it. It's the adaptive immunity. It has four functions. It's specific because it's specific to specific foreign invaders. We can remember who they were, meaning those invaders, so we can mount a response later in life when we see them again. And also differentiates from self to other, okay? What is our body and what is not. And then systemic. This third line of defense is not restricted to an infection site. It can go everywhere. All right, so antigens, they plays an important piece in this story because they're basically the name tags, okay? So when a large molecule on the surface of the cells can trigger an immune response, it is recognized as non-self. So we seeing this guy is a foe because of the antigen, okay? Certain white cells, known as the lymphocytes B, can release antibodies, and those antibodies are going to act upon those antigens. Okay? Now, components of the adaptive immunity. Okay? So we have cellular mediated immunity, specifically T lymphocytes. They themselves directly defend the body by attacking intracellular invaders, such as viruses. Humoral antibody, it's mediated immunity. It's antibodies in our humors or fluids, such as the blood and the lymph, and they can bind temporarily to extracellular invaders and then what? Destroy them by either complement or phagocytes. You're pinning them down, okay? There's also the indirect response. So the B lymphocytes produce and release antibodies, and then they mount a response, okay? So cells involved in adaptive immunity, we have the T lymphocytes, we have the B lymphocytes, and we have the antigen-presenting cells, also known as APCs, okay? So the lymphocytes provide the cell-mediated adaptive immunity. Okay, it's the third line of defense. They do not produce antibodies. Okay, they become immunocompetent in the thymus, hence the name T lymphocytes. Okay, there are different types. There are helper T cells, cytotoxic T cells, suppressor T cells, and memory T cells. Cytotoxic T cells can directly attack and kill other cells. They're found in organs and circulate through our body, and they release toxins that lead to pathogenic cell destruction or attaches to the pathogen cell surface and stimulates their own death. Okay? The helper T cells, they are pretty important because they help activate B cells and T cells. Okay? They also help them to multiply, they mobilize them, not only the T cells, but also the B cells and the macrophages. And without this, our adaptive immunity is down. That's why HIV attacks these cells, and then we are no longer that protected, and we are open to opportunistic infections. Now, regulatory T cells, they suppress the immune response by releasing inhibitory substances or by directly to another immune cell, suppressing the immune response, hence not going all crazy. Okay? And then the memory T cells, they mediate a faster and more potent response upon repeat encounters. I saw you once, now I know what to do next time, so I'm more effective. All right, so APC or antigen presenting cells, they help lymphocytes T to recognize antigens, they engulf those antigens, and then present them to the T lymphocytes so in the future they can see them. All right? Then we have the B lymphocytes. They're produced in the red bone marrow, hence name B lymphocyte. And they include the B lymphocytes and the memory B cells. So we have plasma cells and memory B cells. The plasma cells secrete the antibodies, which bind to the foreign antigens. Makes sense? And mark them to destruction for macrophages and other immune cells. Then the memory B cells mediate faster and more potent response to repeat encounters. That way there's this like the prepare team that is always waiting if you see that invader again. All right, so now we have primary versus secondary immune response. Of course, the primary immune response the first time you see an invader either by a T or B lymphocyte and they come in contact with that invader. Of course, the time to mount that response is not as fast and not as impressive, but then when they see them again a second time, you become faster, right? And that's why when the second time you see that invader, you are prepared for it. And that's what we see here. So we see the first exposure, but then when you see it the second time, your response is faster and better. Now when you see another invader for the first time, it will be similar, but the second time you see this invader, your response will be faster. Now the antibodies are produced by who? Lymphocytes B, okay? They bind and mark via the antigens for destruction, all right? The human body has several types of antibodies, okay? Or also known as immunoglobulins. You have IgD, IgM, IgG, IgA, and IgE, okay? So the IgMs, or immunoglobulins M, are the first antibody type to be released by the plasma cells during the primary immune response. And then those guys activate the B cells and the complement to destroy that invader. Then the IgD also help activating the B cells to destroy that invader. The IgG are the most abundant antibody in the blood, okay? The main antibody in secondary immune responses and late primary immune responses, okay? These guys activate the complement and protects against pathogens in the blood. This guys crosses the placenta, hence why we have that event of erythroblastosis fetalis. Then we have the IgE. They bind to the mast cells or basophils, triggering what? Release histamine and inflammatory chemicals. These guys are related very much in the allergic reactions, okay? Then we have the IgA. They are found in the body secretions such as saliva, sweat, and milk, and intestinal juices. They are very good attacking respiratory viruses, okay? That's why this is passed through breastfeeding. Okay? Now, how we develop humoral immunity, meaning how we develop antibodies in a response to it. There's a natural acquired active humoral immunity. There's an artificial acquired active humoral immunity. There's natural acquired passive humoral immunity, and there's an artificial acquired passive humoral immunity. Okay? The natural active immunity basically is you come in contact with a pathogen for the first time, you get sick, and then you recover, but your body creates memory of that pathogen. So the next time you see that pathogen, you can have a faster immune response to it. Okay? The natural passive immunity, simply think about a mother passing antibodies onto their child. Through what? Breast milk or their placenta. Moms can get vaccinated to certain vaccines and pass this immunity to their kid. Okay? Now, artificial active immunity. Vaccination. Vaccinations are important. Okay? Once we are vaccinated, our bodies can either by an attenuated virus or dead pathogen cells, our body can mount a response against it, and we don't get sick because memory cells are created. Then the less common of them all, it's artificial passive immunity. This immunity is acquired by injecting the antibodies created by another human or animal. Think about antitoxins, antivenoms, and serums. This one is short-term and does not create memory. So if you get bitten again by a snake, you will need again an anti-venom. Then we have our immune system disorders. We have hypersensitivity reactions, autoimmune disorders, and immunodeficiency disorders. So hypersensitivity reactions, think about all the allergic reactions that can be dangerous to our lives, such as people that are so allergic to, for example, peanuts, and it can create immediate or delayed reactions, and it can be life-threatening. Then in the immunodeficiency disorders, the immune system isn't working at a normal capacity, hence we are not endured to get an infection. You can see that in the acquired immunodeficiency syndrome or someone who's getting treated for cancer. Then the autoimmune disorders is when our immune system does not differentiate between self and a foe, and then it attacks our body, so causing damage and inflammation, such as rheumatoid arthritis, diabetes type 1, myasthenia gravis, Graves' disease, or systemic lupus erythematosus. Okay, and they can be either as hard as life-threatening, or it can be something that can be treated. There's plenty of autoimmune disorders to go about. Okay, so this is the end of our presentation. Thank you so much, and you guys have a beautiful rest of your day.